The case study I chose was number 6, which is the case study of Josh B., who has symptoms of Marfan syndrome. Marfan syndrome is a genetic mutation that occurs on chromosome 15. It's located on the gene FBN1, which stands for fibrillin 1. Marfan syndrome is a defect in the gene that produces fibrillin 1, a vital protein that plays an important role in the development of connective tissue. The defect leads to an increase in the protein TGFB, or transforming growth factor beta. This overproduction of TGFB is what causes the numerous complications that can occur from this disorder. Symptoms for Marfan syndrome can share many similarities with other disorders and can go undiagnosed until more severe symptoms appear. A tall, elongated body frame with long, thin, spider-like fingers and toes are the more noticeable expressions of this disorder. Scoliosis, or curvature of the spine, and a sunken or protruded chest are also possible, as well as vision problems caused by a dislocated lens. A dislocated lens is formally called ectopia lentis, and it means that the crystalline lens in one or both eyes has moved to an improper place and is causing vision changes. Some of the more severe symptoms include a weakened and stretched aortic valve, which is the largest artery in the human body. Weakening of the valve can lead to leakage, aneurysm, where the blood vessel fills with blood like a balloon and can rupture, aortic dissection, which is when the inner wall of the aorta tears and causes blood to fill the space in between the inner and outer walls. Can quickly lead to death. The first symptoms that are generally noticed are muscular and skeletal tissue defects, such as the elongated limbs and the sunken or protruding chest, as they are more visible. Lens displacement and other ocular defects are common as well, but the heart and aortic issues are usually not noticed until the patient is suspected of having Marfan syndrome, and the doctor specifically does testing for these disorders. Marfan syndrome occurs in approximately 1 in 5,000 individuals. It's an autosomal dominant disorder where only one affected chromosome needs to be inherited from the parent. So the child has about a 50% chance of getting this disorder passed on from the parent. Marfan syndrome is diagnosed by a clinical evaluation. There are genetic tests that can be done for the mutation on chromosome 15 for the FBN1 gene, but it's only part of the diagnostic criteria used for Marfan syndrome. The diagnostic criteria, it's also known as the Ghent criteria for Marfan syndrome, covers the many aspects of the disorder, from muscular and skeletal issues to ocular defects, cardiovascular, and aortic abnormalities. There are many tests that are employed to diagnose a patient suspected of having Marfan syndrome. There's the echocardiogram, which uses sound waves to create a moving image of the heart. An electrocardiogram, which records heart's electric activity that occurs during a heartbeat. There's the slit lamp eye exam, which is used to check for eye defects. They use a low-powered microscope with a high-intensity light that is shown in a thin beam to examine the interior of the eye. There's CT scans and MRIs that are used to get a clear picture of the internal organs, such as the heart and the aorta. Emphasis is placed on aortic abnormalities and ectopia lentis to decrease the chance of mixed diagnosis, as there can be other disorders that have similar symptoms to the muscular and structural parts of Marfan syndrome. The symptoms are treated on a case-by-case basis, as there are many different symptoms that occur and there's no umbrella treatment for Marfan syndrome. Medications, therapy, and surgeries are common treatment methods used to control complications caused by Marfan syndrome, depending on the type and severity of the abnormality. Ethical issues that have arisen with Marfan syndrome is that there's been a big concern of misdiagnosing patients with Marfan syndrome. They don't meet the proper criteria for a solid diagnosis. Prior cases of misdiagnosis or diagnosis without enough evidence have encouraged some professionals to reform the criteria for diagnosis. Some doctors are worried about the stigmatism and psychosocial stress that goes along with having been diagnosed with Marfan syndrome, along with it affecting their career plans and aspirations, along with their life insurance possibilities, as some life insurance carriers may not want to insure them. Because of this, there are doctors who would rather prolong the diagnosis until it's evidently clear that the patient has Marfan syndrome. In the case study presented, Josh is a healthy 16-year-old who's sent to a genetics clinic for evaluation of Marfan syndrome. It's mentioned that his father's physique is similar to Josh's and that his father died during a morning jog. Marfan syndrome is autosomal dominant, meaning that there would be a 50% chance that Josh got it from one of his parents. And so his father's build being the same as him definitely gives credence to this possibility. People with Marfan syndrome are also actively encouraged to avoid strenuous exercise and lifting due to the aortic defects that are common with Marfan's, and his father passing during physical exercise is another red flag for this. Josh's body structure is characterized by a slender build with long limbs, a protruding of the sternum, high arch palate, arm span to height ratio of 1.1, meaning his arms are longer than his overall height, and stretch marks on his shoulders and thighs, which is another key factor of Marfan syndrome. This, along with the results from an echocardiograph showing dilation of the aortic root with regurgitation, as well as an eye exam showing displacement of the lens, give me the belief that Josh has met the getting criteria for Marfan syndrome.